Hey everyone, my name is Dr. Andrea Fenton, and I'm the National Director of SPEA, along with Drs. Mike Maru and Eric Klintbaum. First, if this is your first time tuning in with us this year, then I'd like to welcome you to SPEA's 10th annual session. It looks a whole lot different than any of us could have imagined, but we're stoked that we have students like you tuning in from across the country to join us virtually. So I applaud you for being here today, and I'm really looking forward to a time in the future when we can all get together in person. So today I have the pleasure of welcoming you to a pretty cool presentation that's focused on helping dental students just like you plan for their futures and make the transition from dental school into either a residency program, general practice, or whatever route you are looking into and considering taking. So we reached out to young dentists all across the country who were in your shoes not too long ago and who have navigated the transition out of dental school into different programs, into the workforce, and they've done it successfully. And they have some stories, some words of wisdom, some advice to share with you all today to make sure that you can have the same successful transition that each of them did. It's really an honor to welcome this group because each person who you'll hear from today was very much involved in either SPEA or another student dental organization during their time in dental school. They've got some really neat stories to share with you all about how their experiences in organized dentistry impacted not only their dental school experience, but has also been formative to their career since graduation. So I really hope that you find all of their stories and encouragement as helpful as I did. And let's give them a round of applause and a big thank you. And welcome. Thanks for being here today.
Hi everyone, my name is Ella Saeed. I am a pediatric dental resident at USC in Children's Hospital Los Angeles. I graduated from UCSF in 2019 and am currently in my second year of residency. I was privileged enough to serve as the president of SPEA in my fourth year. I also was lucky enough to serve as vice president the year prior. In addition to my time with SPEA, I was president of a pediatric health organization comprised of medical, dental, pharmacy, and nursing students at UCSF. And we did a lot of community outreach events and educational events for the San Francisco Bay Area. In addition to my community work, I also did a IDEA research fellowship in my third and fourth year, and that was a fantastic experience. So just to talk to you guys a little bit about why I decided to pursue my specialty training in pediatrics. It actually started as an interest. I knew that I liked working with kids, but when I went out into the community and I started to see more of pediatric disease in the hospital setting, I realized how important and significant oral health was to the development and health of children and adults in the long term. The unique thing about the specialty of pediatrics is that we do treat medically complex patients and patients with special healthcare needs. A lot of these patients wouldn't be seen in a traditional clinic outpatient setting, and so it is very important, and it did draw me to the specialty because of its complexity and its diversity in terms of treating all these different kinds of patients. Some of my advice for you in terms of applying, whether you are applying or you are still exploring specialties, would be that if you are just interested in seeing what you'd like to do, or if you're interested in general practice, my advice to you would be explore every specialty. Even if you're not doing externships or internships with every specialty out there, it is a very good tool to have to understand each specialty and to be able to recognize various disease. So when you are in practice, whether you're a general practitioner or you're a specialist, you can actually steer your patient in the right direction, and it helps you kind of tailor the treatment custom to your patient as needed. If you are currently applying to residency, congratulations. I know that it's a lot of stress right now, but my advice to you is do not stress. I know interview season is coming up. For those of you that have already started, that's fantastic. And for those of you still waiting, do not worry. I know that preparation for interviews can be a bit looming. So a gem that I kind of found when I was applying to residency was to actually speak to yourself in a video and answer some interview questions on tape and re-watch yourself answering these questions. It can be a little bit mortifying watching you speak in the beginning, but it does help refine the way that you're going to answer these questions and gives you an opportunity to think about what you're going to say. So I highly recommend turning on your video and answering any kind of interview questions in preparation for all of those interviews coming up. I also want to emphasize how important your didactic training is in dental school. All that pharmacology and physiology and even biomaterials that we get in dental school will actually help steer you and guide you in your clinical judgment in the future. A lot of your patients are not going to be textbook, so my advice to you is review, retain, and apply as best as you can and practice all that information that you're learning right now in dental school, and just make sure that you have access to that, whether you're in residency or in practice after this. I will leave you with a ethical pearl, and that is to just stay honest and keep your standards high. I know that dentistry can be very stressful, whether it's from a clinical standpoint or from a business or financial standpoint, but don't forget to treat your patient as a whole and look beyond just your system. We can sometimes tend to focus quite a bit on the dental issues going on, but we forget to look at everything else in our region and in the patient's health. So I do remind you to take the time to treat your patient as a whole. Make sure that you are always up to date with things that are changing in medicine and in dentistry, and to make sure that you're staying honest and ethical in the way that you practice dentistry. I wish you all the best of luck. Enjoy this annual session. I'm sure it's going to be a fantastic time. Thank you.
Hello everyone, my name is Joshua Bassard and I'm a graduate of the Indiana University School of Dentistry and current AEGD resident in Hawaii. I'm excited to share about my transition from dental school, and I'm thankful for my involvement in the Student Professionalism and Ethics Association in Dentistry. SPEA helped develop my leadership skills and ignited a passion for organized dentistry. Throughout dental school, I'm fortunate to have held a national leadership position 4 consecutive years, and I'm currently concluding my role on the National SPEA team as immediate past national president. In these roles, I've had the opportunity to work alongside a fantastic group of dental students and professionals across the United States and Canada. I'm blessed and thankful to have obtained licensure, graduated from my dental program, and transitioned to an AEGD all in the heat of a pandemic. Early in my dental studies, I discovered that there were programs providing mentorship in the years following dental school. As a first-generation dentist, the idea of having built-in mentorship immediately called out to me. I knew that this opportunity would allow me to improve upon my procedure time management, recognize my limitations, and hopefully minimize them. Regardless of the direction of my dental career is headed, I knew that investing in myself and becoming the best general dentist that I can be would solidify and improve upon my foundation, as well as significantly enhance whatever lies ahead. I'd like to take a moment to briefly visit about 2 types of residency programs that are available to dental students following graduation. These include Advanced Education in General Dentistry, commonly known as AEGD, as well as General Practice Residency, or GPR. AEGDs are located in a variety of settings and are often reflective of clinical procedures that would be completed in a private practice setting. In contrast, GPRs are usually hospital-based and have emphasis on medical rotations throughout the curriculum. With that being said, both offer great clinical experiences, but once you've seen one program, you've really only seen one program. And what I mean by that is that each program and location is unique and may have more emphasis in certain areas of dentistry than others. As I was discovering this, I found it very helpful to ask current residents what their experience was like, what procedures they were doing, and this would give me insight into what the next year could look like for me. I applied, interviewed, and was accepted into both of these types of programs. As I was interviewing, I considered the clinical experience each offered, the program director, and my gut feeling when I was visiting the program. I could tell almost immediately if the environment was geared towards my learning, and I knew that I'd spend countless hours treating patients in the clinical space, so it was important for me to be in an environment where I wanted to be and would learn well. If you are considering a program following graduation, my biggest advice is to find a program that's geared towards your learning, and also consider life outside of clinic as well. Let's face it, dentistry is stressful, so it's so incredibly important to consider your wellness and to have opportunities to enjoy life outside of clinic after working so hard to achieve your goal of becoming a dentist. By taking care of yourself, you will be able to better take care of your patients. So whether you're transitioning into practice or residency program following dental school, I'd like to share some advice that has helped me along the way. 1. Be adaptable. 2. Don't pass judgment based on someone's appearance. 3. Pay it forward. 4. Don't let money or requirements dictate a patient's treatment. 5. Surround yourself with positive people who encourage you to be your best. 6. Leave conflicts outside of clinic. 7. Don't fake your understanding. 8. Show your patients you care. 9. Don't talk bad about your staff or coworkers. And last but not least, 10. Lead by example. I'm thankful to SPEA for helping shape me into the person and clinician I am today. During our annual sessions and our national leadership meetings, SPEA stimulated growth, stretched my limits, and pushed me outside my comfort zone. I even skydived for the first time. And in many ways, my dental journey is like skydiving, taking a leap of faith and learning along the way. There were successes and definitely difficult times that challenged me, but what I remember the most are people I formed connections with along the way. I'm rooting for each and every one of us and excited to continue improving our profession. There will continue to be bumps and difficult times as we are navigating this pandemic, which is why it's so incredibly important to become active in organized dentistry in some capacity. So I hope that you'll consider becoming involved, and I look forward to the opportunity to collaborate together. Take care.
Hi, my name is Judy Naziri. I'm a second-year orthodontics resident at the University of Southern California, and I was involved in SPEA throughout my time in dental school on my local chapter, and I also served as the executive chair in 2018. I'm here to answer some questions for you guys today. So the first question is, how did you decide that you wanted to pursue your specific specialty? The funny thing is I actually didn't know that I was interested in orthodontics until I actually sat in on a treatment planning session. I always thought ortho was kind of boring until I realized what it really was, and it was a puzzle. You know where you're starting, you know where you want to end up, and there's hundreds of ways to get there and finish the puzzle, but yeah, I guess that's what really drew me into ortho. The second question is, what has been your favorite part about your residency or work so far? So my favorite part about ortho is seeing the teeth move. We always have the patient's original records and photos up at each appointment. So after it's been a while and the teeth are moving, it's fun to hear your patient say, "Oh my gosh, I'm so happy my teeth don't look like that anymore." And you kind of show them where they are now and where they started. And yeah, that's my favorite part, definitely. If you can go back to dental school, is there anything that you would do differently? Yeah, if I could go back to dental school, I'd say it's shadow more dentists or orthodontists. I'm quickly learning that dental school is very different than private practice, so it would have been cool to get a feel of both at the same time and see how private practice works and how that compares to the school setting. The next question is, what advice would you give to students to help in the transition from dental school to residency or the workforce? I'd say the biggest piece of advice I would give to students is make time for yourself. You know, school is very demanding and there are always little pockets of time that you can have, and I'd say use that time for yourself to do whatever you're interested in, pick up a new skill, travel. I guess that's not really appropriate for right now, but maybe pick up a new hobby or just do something that you've always wanted to do. Share a word of advice or a piece of wisdom that has helped you in dental school or has helped you in work or residency. Something that has helped me in dental school is just knowing that everyone has something that they can teach you. So let them. Get to know your patients, get to know your classmates and your faculty. It's not until people open up to you that you really get close to them that you really start to learn. So I'd say the biggest thing you can do is just Be as friendly as possible to everyone that you interact with and let them teach you. Share how the pandemic has impacted your experience or how you feel the pandemic will affect the future of your specialty or dentistry. Being in Los Angeles, there are a lot of changes that we've had to make to our clinic for everybody's safety. But even with all the changes, I still think there's a pretty bright future for the orthodontic field and dentistry in general. If anything, I've learned that with orthodontics, even if you don't see your patients once a month like we usually do at our school, the teeth will move and you'll still move towards your goal of getting them a beautiful smile. Share an ethics and professionalism pearl that has helped you in your residency or work. I'd say given today's climate, it's important to always remain professional. You should accept that you'll get difficult patients that don't want to stick to the rules and don't want to show up early to answer questions and stuff like that, get their temperature checked. But you always have to remember that we're in this together, and as long as you stay professional, there will be a good outcome. So keep calm and stay professional and ethical.
Hello SPEA friends, my name is Jessica and I am a first-year oral and maxillofacial surgery resident at Nassau University Medical Center. My journey with SPEA began in 2016 where I founded a SPEA chapter at Touro College of Dental Medicine. Through this experience with SPEA, I was able to meet incredible colleagues and inspirational mentors who all supported me and encouraged me along my journey to oral maxillofacial surgery. My biggest tip for dental students who are transitioning into either residency or work life is to maintain an open mindset. Remember that despite the fact that we're living through a pandemic, even when we get past this coronavirus, you're still going to be facing many different challenges every day, several of which you probably won't anticipate happening. Through these different situations, it's important to remember your ethical values and to maintain professionalism while being open to changes for yourself, for your patients, and with respect to your relationship with your colleagues. I wish you all the best of luck, and I hope that SPEA is able to help you as much as it's helped me.
What's up, SPEA family? My name is W.J. Belke. I graduated from Roseman University in 2019. I then went on to do a residency program in Las Vegas, Nevada, an AGD program through NYU Langone. I'm now in private practice in Salt Lake City, Utah, and I was the Chief Information Officer of SPEA, National SPEA, in the 2017-2018 school year, and loved every second of it. Hope you're all doing well in school, enjoying your time in SPEA, and thanks for asking me to be a part of this project. Hopefully I can answer a few questions and give some insight to people who are making this transition onto residency or the workforce. I think this is a great question, especially for anyone in their last couple of years of dental school. And I've actually got two answers for it. And the first one is that your career, the type of dentist you want to be, you can make that whatever you want. It doesn't matter where you went to dental school, what kind of experience you had in dental school. There are so many opportunities to learn anything about dentistry once you're out of school that I really believe you can become any kind of dentist you want. And instead of leaving that up to chance, I think it's smart to start putting down on paper goals, ideas, visions of the type of dentist you want to be, and then going out there and making it happen. And feel free to change what that looks like as you grow and discover more things about dentistry and about yourself. But I wouldn't leave it up to chance. I would have an idea of what you want, and then I would just make it happen. The second answer to that question is to find balance in your life. I know that when I was in school, that was the only thing on my mind 24/7. I had no balance in my life. And when I got out of school, when I graduated, all of a sudden I had more free time and more money. I didn't know what to do with any of it. I actually picked up golf about a month and a half ago, and now I don't have money or free time because it's all spent on golf. But find something that allows you to take your mind off of work, off of dentistry. And I know for myself that I quickly realized that if I can step away from work and leave work at work, that I'm a better dentist, I'm a better provider. Because I can come into work refreshed and I can focus on what it is I'm doing. And I need that for, myself, my personal sanity, but I feel like it's something my patients also deserve. They deserve the best provider that I can be, and finding that balance allows me to give that to them. If I could offer just one simple lesson from my time in SPEA, things that I've learned that I've been able to apply in my daily work now, I like to approach every patient with the attitude of, I'm just going to take care of this person. It's really easy and important to, get really into a deep conversation on the topics of ethics and professionalism. But the reality is that you don't always have time to weigh out all of those things and think back on those things. And so for me, to keep it simple, I just approach every patient with, I'm going to take care of this person. It's not going to be dictated by if I'm ahead of schedule or behind schedule, or what their insurance situation is, or their finances, or what kind of mood I'm in. I just try and really keep it simple, and I'm just going to take care of them. And what I've learned, and I think you all learn really quickly, is that you're not going to make everyone happy. But I can promise you that if you just approach every patient with, I'm going to take care of this person, you'll have a lot less sleepless nights, and you will have a lot more fulfillment day to day in what it is you're doing, no matter if you're in residency or in the workforce. For me, that has been the most valuable thing that I've learned from my time in SPEA. Thanks again for asking me to be a part of this project. Best of luck to everyone transitioning from school to wherever it is you're going. I put my email address here at the bottom of the screen. If you have any questions about residency or private practice or Vegas or living in Salt Lake City, I'm more than happy to help and answer those questions, and feel free to drop me a line.
Hi, my name is Katie Bell, and I am a pediatric dentist. Currently, I reside in the Nashville area. I'm a 2016 graduate of the University of Alabama at Birmingham, or UAB, School of Dentistry. Following dental school, I moved to Denver, Colorado, where I completed a 2-year residency at Children's Hospital Colorado in pediatric dentistry. After residency, I moved to the Minneapolis area, where I served as an associate pediatric dentist for a private practice in the Twin Cities area. Just recently, I relocated to the Nashville area to be closer to family. It is a distinct honor and privilege to be able to speak with you a little bit about my journey in dental school and my journey to becoming a pediatric dentist, and the decision-making process as well. When I started dental school, I didn't know exactly what I wanted to do after dental school, so I was very open-minded and committed myself to learning as much as possible about the different specialties and about general dentistry, and about how I may use the next step, whether that would be entering private practice or a specialty program, to be able to serve those around me. As far as organizations with which I was involved, obviously I was a part of the Student Professionalism and Ethics Association. I had the honor to serve as a regent, and then to serve as the Student Professionalism and Ethics Association Executive Chair. Additionally, I was involved with the American Student Dental Association and participated in the National Dental Student Lobby Day. I was also involved with research and was grateful to be able to attend a national conference dedicated to student dental research. I was also active with the Christian Medical Ministry of Alabama and participated in a mission trip to Honduras. And that was one of the, I feel like, key events that led me to really pursuing a career in pediatric dentistry. Additionally, I tried to be as active as possible, both through activities like intramural soccer, but then also through doing things that I enjoyed outside of dental school, like running and keeping up with friends and family in the area. So again, it's a distinct honor and privilege to be able to share with you my journey, and then also some bits of advice that I have for you as you are looking to make that next step, or looking to make a decision regarding your next step. My first piece of advice would be to ask questions. Don't be afraid to ask questions of those who are farther ahead of you in dental school, or who are in private practice or academics. Don't be afraid to ask others if you are interested in shadowing them. I personally am always excited to have others shadow, and I would be more than happy to answer any questions that you have from my perspective as someone who has been in private practice for about 2 years now, and also about the residency process as well. Don't be afraid to reach out to those who, again, were just in your shoes just a few years ago or maybe several years ago. That's one of the great things about dentistry is the camaraderie, and my hope is that you have appreciated that and you have experienced that, whether you are a first-year dental student or a fourth-year dental student. My second piece of advice would be to be as open-minded as possible and to look into every specialty that you may be interested in. Everybody's journey is different. For me personally, I had a lot of different interests, and so I was committed to looking into everything as much as possible initially. However, it was during a mission trip to Honduras that I saw just a need to be able to serve those who may not have gotten routine dental care. And it is a desire of mine to be able to go back to the mission field at some point and be able to serve those who may not have received routine dental care, because there is a great need. And so I saw that as an opportunity, an avenue as a pediatric dentist to be able to serve children in other countries who may not receive routine care. Additionally, another factor that led to my decision to becoming a pediatric dentist was I had a brother that I never met. He passed away from complications following birth, but had he survived, he would have been severely handicapped and would have had disabilities. And for me personally, I wanted to be able to be in a position where I could serve children and adults with special needs who may not otherwise be able to receive routine dental care, simply because others did not feel as equipped to be able to care for patients with complex medical histories. And so I realized that I needed to go to a residency program to be able to learn what I needed to learn to be able to serve others with special needs. And so I think that those two factors or events, experiences, both the mission trip and then also just the desire to be able to serve those with special needs, really propelled me to pursuing pediatric dentistry. When I was in the final decision-making process of, okay, what's next? I asked a lot of questions. I shadowed those in private practice and in academics. I completed some externships and, again, reached out to others who were going through the process themselves. So if I can give you just a big summary, I think is just to ask questions, and don't be afraid to do that. I think sometimes we can be concerned that we might be bothering someone if we ask questions, but know that that's not the case. And I will say though, just knowing that you're involved with the Student Professionalism and Ethics Association, my guess is that you're probably one to ask questions. And so I just applaud you for being a part of an organization that exists to promote ethics in dentistry and high standards of professionalism. If there's ever anything that I personally can do, whether it's answer questions about pediatric dentistry, we have had just a little bit of time to talk about my journey, and I would be more than happy to provide a little bit more insight into the application process, residency, pediatric dentistry itself. Please don't ever hesitate to reach out. Again, I am in the Nashville area, and I am just excited for you as you continue through dental school, whether you are a first-year dental student or whether you are a fourth-year dental student looking to finish up this year. And I also just want to applaud you for continuing through dental school at such a unique time in history with COVID. And I can only imagine what it would be like to go through dental school with the COVID pandemic as well. And so just continue working hard and don't be afraid to ask questions. Dental school is hard, and just know that you are not alone, that you have others around you who want to encourage you as well. Good luck with everything and have a wonderful week.
Hi everyone, my name is Austin Shackleford. I am a third-year oral pathology resident at Columbia University. I was involved in class leadership, and I was also involved in ASDA while I was in dental school, which was associated with SPEA, and so got to be involved in that aspect too. So how did I decide to pursue oral pathology? I had no idea what oral pathology was until dental school, but I really liked the class. And then as I looked more into it, there are a lot of things that I really enjoy about oral path. I really like the balance between being able to do some teaching, do some research, and then see patients in the clinic. It's been great to go back and forth between doing some head and neck cancer research, as well as learning surgical biopsy procedures. It feels like it's the best of both worlds. Something I wish I knew prior to starting residency. Well, oral pathology specifically, I guess. We do a general pathology year, and that includes doing autopsies. I never really expected, as a dental student, to go into doing autopsies, but it is an absolutely fascinating component of the residency, and it really helps build the foundation. And then another thing about PATH that I didn't realize is how much gray area there can be in some diagnoses. I always thought that you submit the tissue and then it gets plugged into a computer and you get the diagnosis. That's what the lesion is. But there's a lot of discussion, and it's almost like figuring out a puzzle sometimes for certain lesions. I always thought it was like benign or malignant. Sometimes it can be a very thin line between calling something benign and calling something malignant. And so that has been a very interesting part of PATH that I've enjoyed. A word of advice or wisdom that helped me in dental school and residency. One of my classmates in dental school had mentioned, and you hear it all the time, but establish good habits. And so, getting into your groove, what works for you as far as studying for exams, preparing to see patients, establish good habits, get into a rhythm, and it really helps you thrive in dental school. Ethics and professionalism, Pearl, that has helped in dental school and residency. If you even get the hint that you're in an ethical dilemma or situation, that means you are definitely in one. And a lot of the time that it happens, you feel like you're alone, and you feel like it's a very difficult decision that you, for some reason or another, can't talk to somebody else about. When in fact, most of the time, there have been lots of people who have been in that same situation that you are in. And it's important to just reach out and talk it through with somebody. That can help, come to make the best decision for that situation. And so there's nothing new under the sun, so to say. But with that, best of luck with the rest of dental school, and good luck on residencies. Thanks.
Hi everyone, my name is Rupali Kulkarni and I graduated from the University of Pennsylvania School of Dental Medicine in 2019. Throughout my time in dental school, I was actively involved in organized dentistry and had the opportunity to collaborate with SPEA through my involvement with ASDA. I was involved at the local, district, and national levels of ASDA, most notably serving as the national president from 2018 to 2019. What I can say is I never imagined what my dental school experience would be like. I had dreamt about being a dentist since the age of 7, but had no idea how vast the profession really was and what my opportunities were professionally until I entered dental school. Fortunately, I went to Penn and I was able to pursue a dual degree and received my Master of Public Health. And public health was something I was very passionate about prior to entering dental school. And so I was able to marriage my passions together through pursuing both my dental degree and my Master of Public Health degree. And when I started out as a first year, I was unsure of really what I wanted to get involved in and where I would put my time and energy in, what communities I would really be a part of. And I fortunately found great mentorship and built relationships with fellow students as well as dentists throughout my time in organized dentistry. And so as I continued on, I ended up learning so much more about the dental profession and non-traditional pathways of our profession. And so my first year, I was exposed to oral medicine as a specialty. And most people don't know that oral medicine is the intersection between dentistry and medicine. And so although part of the scope is still performing general dentistry procedures for a medically compromised population, a lot of it involves the clinical application of pathology, radiology, as well as oral manifestations of systemic conditions. And so I learned so much more about how I could really be a doctor of the mouth and to really put together this concept of oral health and systemic health. So fortunately now I am serving as the chief resident of Penn's Oral Medicine Residency program. And it has been one of the most rewarding experiences of my life. I've learned so much more about myself as a clinician. And although I had many different leadership experiences in the past, being a leader in a clinical setting comes with its own challenges. And so one of those was being chief resident while also attempting to learn and provide care during a global pandemic. And so when I think back on my times in ASDA, but also with the collaborations that we had with SPEA, I was really actively involved in dental licensure reform. I helped form and be one of the executive committee members for the Coalition for Modernizing Dental Licensure, worked a great deal on creating exposure to alternate pathways for licensure, and then even this year finished up my term as vice chair. So alongside my residency program and providing care to patients, I was also working on that. And this year really brought about a lot of different changes in terms of dental education, dental licensure, as well as patient care. And so my overall goals are actually to pursue academics, and I hope to gain a faculty position after residency. So some of the things that I'll say that I think are really important as you continue on in your dental education is that there is no one right track. I could have never imagined that after taking a gap year in between undergrad and dental school, that I would end up pursuing a specialty that I knew nothing about as a first year, and realized how much I cared about dental education and wanting to help train the next generation of dentists and leaders. And so what I'll say is keep an open mind, allow yourself to try new things, and step out of your comfort zone, build relationships, talk to different dentists, and learn about non-traditional pathways, because you never know what your passion really is going to be and where your skill set will lie. I'm wishing you guys all the best as you continue on with your education. I hope you enjoy people's advice, and I'm always here if you guys need any support, or I'm here as a resource for you all. So thank you so much for allowing me to be a part of your program.
Hi SPEA, my name is Jill Torchio. I graduated in 2019 from the Indiana University School of Dentistry in Indianapolis, Indiana. Since graduation, I've had a pretty busy, year and few months. Immediately after graduation, I had about a month, got married, moved the next week, and the following week I started 2 different jobs. So that was kind of a busy summer, fresh out of dental school. I spent my 2 jobs, one was in Indianapolis and one was in my hometown of Fort Wayne, Indiana. My Indianapolis practice was a pediatric practice where we saw a lot of Medicaid children. We did a lot of work with, extractions, things like that, the things I was really uncomfortable doing. So that was a little bit stressful. My practice in Fort Wayne is actually my family's practice. So my grandfather started it in 1956. My dad joined the practice in 1984, and then I was able to join in 2019. That was, kind of more middle of the road for me, so that was exactly what I was expecting out of dentistry, and it, really worked out very, very well. So in June of this year, I moved up to Fort Wayne full-time, and I'm with my dad at our practice 4 days a week now. So it's been a really, really good but very, very busy year for me. COVID really changed my very first year of dentistry. Mostly, it was fine, but there was days where it was really, really scary. I'm sure a lot of you were kind of in that same boat. So about 9 months into practicing, I had to say, am I ever going to be able to do dentistry? I worked my whole entire life for this. Is this ever going to work out for me? So it was just a very emotional couple of months there for a while, but things have really calmed down now, and I'm really, really thankful for that. A little bit about my background. I started at Indiana in 2015, straight out of undergrad, and pretty much immediately after coming to school in Indianapolis, I joined SPEA. And I still to this day say that being a part of SPEA was the very best thing that I did in all of dental school. It was such an important reason why dental school was such a fantastic experience for me. I just got to meet so many wonderful students like you guys. I had great mentors through SPEA. I got to meet people from all over the country by going to annual session. And I just really was able to kind of find my happy place in dental school, and it really kind of changed my whole experience through dentistry. So that is still the number one thing that I'm most thankful for when I think about kind of my whole 4 years in dental school. As far as what I did in SPEA, I started off just as a regular member. I was our freshman kind of first year liaison, I guess you could say. So I was just kind of the contact point between the rest of the chapter and trying to get more new members from my own class. During my second year, so April of my first year really, serving for my second year term, I was the president of our local chapter, Indiana. That was a really, really fun year. I got to have some good leadership experience, which is part of the reason SPEA was so great. It really taught me how to be a good, strong leader, how to listen to people, how to communicate well. During that year, our membership in our chapter actually doubled. So it was a really, really fun experience for me and the rest of our team, just kind of getting to see that chapter blossom and grow into what it is now, which I'm very, very hopeful that it's still as great as I was when I was there. That year went great. Third year, I was elected at our annual session to be our Regency 4 regent. So I had 10 schools that I worked with in the Ohio River Valley. And again, that was wonderful. I got to meet our national board. Hi, guys. And it was just so fun. We got to travel. We got to communicate a whole lot. And it really helped, again, grow me into the dentist I am now and hopefully continue to shape the future of dentistry. So I could not be more thankful for that. Thank you all for inviting me to come and, Zoom in, record in, and talk to you guys, because it's, the number one thing that I'm most thankful for. It really means the world. As far as, what has SPEA taught me, it's been really good for me being out in practice now for a little over a year to kind of be able to relate to my patients and to understand, okay, what are you freaking out about right now? What's causing you this stress? What's on your mind? What's preventing you from taking care of your mouth? All those things. So I'm able to kind of take a step back a little bit and say, this is not about me. This is not about my paycheck, my income, my future. This is about taking care of the patient and being able to kind of dissociate yourself from the pressures that are on you as a practitioner. It's really important to be able to say, I'm not here for me. I'm here for the patient. And especially during COVID, I would say during COVID, it became more and more important. We were all really, really scared. The world was telling us that we were the most dangerous profession to go into. And it was, saying the aerosols. Oh my goodness, what are we going to do about aerosols? You have to be in this full hazmat suit to see patients in dentistry. Are patients ever going to feel comfortable coming back to my office? Are patients ever going to feel comfortable going to get their 6-month hygiene appointment? We had no clue. And so we were able to see emergency patients. I was working emergency shifts at both of my offices, and it was really kind of scary. I was, oh my gosh, I have to go be around my office staff, the one assistant who's agreed to come in and help me today. And we would rotate that way. And, oh my gosh, what if this patient hasn't been socially distancing? What if she hasn't been quarantining? All those things. And just kind of stepping back and say, you know what? I'm a healthcare provider. I am not someone who's off the street being asked to kind of step into this position. I took an oath when I graduated. I put myself in a position where I value that patient's well-being over my own. And you have to just kind of remember that. You are a very grounding person in these people's lives. They look to you. You are the doctor. You are the one who should know about this virus. You are the one who should make me feel better, make me feel safe, understand the science, all those different things. And so that kind of helped me to say, you know what? This is what I do. I'm here to make your life better. I'm not here to protect myself. So that really kind of helped me, give me a little bit of confidence, say, hey, I can handle this. I can handle this. And luckily, it's been fine. So that's kind of been one of the ways that this whole pandemic has kind of shaped me, I think, as a professional, as a dentist, to say, it's not about me anymore. It's not about me at all. This is all for the good of the patient. So that's been, a really, really great experience. Some other things that I really kind of highlight from dentistry, some advice I would give new graduates and even current students who are kind of saying, what's life going to look like for me? The number one thing that I think has helped me in my, just over a year of practice is having really, really great mentors. I still reach out to some of my favorite faculty members from school who, at graduation were, crying, oh my gosh, this has been such a crazy 4 years. Thank you for helping me get through dental school. I'll still text them, hey, just thinking about you. Thank you so much for teaching me about X, Y, or Z. Or thank you again for supporting me in the clinic when I was having a rough day. And I think that really means a lot to them. So more importantly than just outside of, your dental school life, finding those people in the real world. I'm in private practice. I'm a general dentist. I didn't go on to specialize. I'm very, very lucky to live in a community where we have specialists all around us. So literally we have a parking lot that we share with the surgeon's office, and there's 2 surgeon's offices within a quarter of a mile from us. We have 3 orthodontists in our little corner. We have a pediatric dentist. We have an endodontist. We have a little bit of everything. And those people have all really become some of my best friends just this year. They're 3 times my age. Some of these guys are a lot older than I am, but they are so, so kind. They'll say, Jill, how's your day at work today? Oh my gosh, it was so hard. I was doing this buccal class 5 on 15 and I couldn't see anything and I got the cheeks in the way and everything was so hard. And they just laugh. They're like, yeah, we were all there. And it makes you feel so much better. And then you can always feel, hey, I'm really having trouble with this. Can you explain this? Can you walk me through this? Any simple little question that you might have, they are so patient, so kind, so willing to help. And they really find it refreshing to have someone young who's so eager to learn about dentistry. And again, it's just been such a wonderful experience to have all of these people who can really kind of help me out. So that's kind of my biggest piece of advice is find your mentors, find your little group, expand on it. Go to your annual meetings, go to your local component meetings, go to any event that you're invited to. I try to go to it if I can. I don't care how tired I am. I'm at those meetings, I'm talking, I'm learning, meeting people, getting contact information, and trying to make those relationships because it really, really has made a huge, huge difference for me. And it's, again, something that I would request that every single student really tries to do, especially straight out of school. So young dentist committees, all those different things, just get yourself in there. Don't be afraid to put yourself out. Every single person's in that situation. And it really, really helps a ton as you kind of get your footing. And again, you might kind of feel kind of stupid. Oh my gosh, I can't even do this. I was struggling with this DO on, 18. Why can't I do it? And they're like, that's hard too. They'll make you feel so much better. And it's been really, really important for me. It also kind of gives you the chance to listen to their struggles, which I really, really value. Makes you realize that you're not the only one who still has bad days. That first year, when I first started, I said, I've had about 50-50 good patients, bad patients. I struggle so much. This first year has really helped me grow into my own. I'd say I've got 90% good days, good patients. I still have that one that makes me go home and cry. It's just going to happen. We have just hard situations, but every day it does get better. There's times when I look at a patient and say, why can't I do this? I'm really, really struggling with this procedure. What am I doing wrong? What would someone else do differently? If I asked one of the other dentists in my practice, hey, I need help with this. Can you help me? What would they do differently? Sometimes I can't identify that, and I just have to remind myself I am not that experienced yet. Pretty much every dentist I talk to says, oh yeah, 5 to 7 years and you'll feel good about things. It doesn't really make me feel great, but it's good to know that I'm not horrible. I don't need to quit. It's all okay. But just understanding that sometimes you'll say, thank God I got through that. Now I can do it next time. Other times you're going to say, I'll struggle with that again next time. And that's okay. It's frustrating. One other tip that I use a lot in my practice is a good exit strategy for when I'm really kind of in over my head. Luckily, I haven't had to use this a ton, but it's nice to kind of know some of the things that you can keep in your back pocket. So my assistants, from the very beginning, we've got 4 wonderful assistants at our office, and I made it very clear to them, hey, don't be afraid to tell me if I'm doing something wrong. If you see something that I'm struggling with, let me know what you think would help me. And so sometimes, it's a really delicate balance where they don't want to kind of chunk the doctor and say, hey, Dr. Jill, why don't you try this? But they'll come to me afterwards and say, you should really do this differently next time. Why don't I get this special material out? Let's try this. But sometimes they don't know that I'm struggling. And so we've got certain things that we use from time to time. And the patient doesn't exactly know what you're doing and why. So, really hard crown prep. Can I have a cotton cap? Hey, Brandy, can you get me a cotton cap? And a cotton cap is just this little upside down cup, and it sits over that crown prep, and it's really fantastic. It pushes the gum tissue out of the way, does a great job, but sometimes you don't even need that. You just need the patient to not know why you're leaving. Hey, let's paint some of that hemostatic agent on this too. Let's really clean this up so we can get a good look at it next time. I'm going to paint this on. I'm going to have you bite on this cotton cap. Then we're going to be able to see really, really well. And I run to the back. Oh my gosh, Dr. Hemphill, what the heck am I doing? Can you help me? Can you look at this x-ray? What's happening? It's a great way to kind of distract the patient from knowing that you are maybe a little bit stressed and in over your head, but they think that it's just part of the procedure. So find these little things at your offices, in your dental schools, that you can say, hey, I need you to bite down on here because of some reason. You can make it up, whatever. Don't make up any crazy lies, but sometimes even, it's going to push your gum tissue out of the way. I don't need your gum tissue pushed out of the way right now, but it's going to help us, So that's something that, your patients don't want to know that you're fresh out of school. They don't want to know that you're really struggling. Even the older dentists in my practice, they struggle with things all the time, and they use these strategies too. So it's something that you don't have to feel embarrassed about, but don't, try not to let them lose all their confidence in you. Have that confidence, have that strength to know, hey, I need to still do good work. I need a little bit of backup, and have a graceful exit strategy. So that's something that's been kind of a fun little delicate balance that I've practiced over the past year. And I do think it makes a huge difference, and I think it's very important for me to provide the best care to my patients by using some of these strategies. So I really hope some of these little pearls are helpful to you. Anyways, as far as dental school goes, as a new dentist, I saw a lot of limited exams when I first started. So patients, didn't know me, wouldn't necessarily jump to schedule with me. So we'd have a patient call in, hey, my tooth is really hurting. Can you help? Can you help? Sure, Dr. Jill will see you. So I had to really kind of understand a lot about endodontics, oral surgery, diagnosis in that sense. That stuff I think we get a pretty good understanding of in dental school. What I didn't learn a lot about in dental school was TMJ disorder. And I have a lot of patients who are like, hey, I've got this toothache, there's no cavity, there's no this or that, and they're pointing right up here, and it's like, oh my gosh, and it's popping, it won't open. What the heck am I supposed to do? I have no idea. So I'd say, find a faculty member that you really, really get along with and that you trust and that you think knows a little bit about TMJD, and say, hey, can we sit down for an hour after clinic, during lunch, something, and just kind of go over some of these things. What would you do? A lot of times it's, hey, you know what, I want you to take 600 milligrams of ibuprofen, put a warm washcloth, get it wet, put it on your face, keep your mouth gentle today. Don't be eating your hamburgers. Don't be chewing your gum. Do this, do that. If that doesn't help, let's make you a quick bite appliance and learn how to do something like that. I use something called a quick splint. It's just spelled exactly how it's said. You put literally bite registration material in it, send them home for 2 weeks. There's videos online. They're super, super helpful. I actually learned those at the Pankey Institute down in Key Biscayne, Florida. So that's another thing to check out. Good CE. But just things like that. So learn little tips and tricks that you can start to get with those limited exams, those problem patients that you might find when you're first in practice and think that you're over your head in them. My other advice for finishing out dental school, prioritize what you're learning. You learn a lot of stuff in dental school that, I had a problem with certain subjects, and I'm like, but it's, I don't need to know about the reproductive system. That's fine. And that's pretty much held true. We don't need to be diagnosing any sort of things. We're not allowed to. But the things that, figure out exactly what order to do X, Y, or Z in when it comes to whatever procedure you might be doing. If it's root canals, know exactly which sealer, which cavit, all those things do. That'll help make your life just a lot more simple so that it's not day of, you have 30 minutes to go back and find your dental school notes. That's just not all that, helpful. So focus in on the things, prioritize your learning, get a good broad scope of everything so that you say, oh yeah, we learned about that in dental school. Don't remember a whole lot about it, but I could go find it if I needed to. It's not pertinent to right now, but be able to kind of find those things and really kind of, think about your future. Think about what you think you're going to be doing the most often, what you think you might not have to use all that much, and keep those organized in a way that, if you need to, you can go back and find them later. That's really all I can think of right now. I hope you all have a fantastic annual session. I know it's a little bit different this year. I can say that annual session was one of my favorite times of the year. I was able to go all 4 years throughout dental school. So I'm really kind of sad that you guys can't all be together. It's a fantastic networking opportunity. I can tell you that, you're always welcome at SPEA. I wasn't able to get out to San Francisco during my first year in private practice, but if I would have, my first stop would have been to SPEA annual session. I know Mike and the team are always so happy when they see alumni come through, and will always be able to come in and say hi. So maybe next year, I really hope everything is cleared up, and I would love to come in and stop by, say hi, meet some of the other SPEA students. But SPEA is truly a family that you will always, always have. So enjoy it, talk to each other, get your emails, exchange numbers, keep in touch, because it's just a very, very special group. I hope you guys have the best rest of your day, rest of your annual session. Josh will have my phone number, my contact information. If anyone needs to reach out for any reason, I'm always an open book. I really love to help other students out. So take care. Thank you all for having me. Goodbye.
Hi, my name is Jeffrey Kirst. I am a general dentist in Shreveport, Louisiana. I attended the LSU School of Dentistry, and while I didn't hold any kind of leadership positions in SPEA, I was the National Vice President of the American Student Dental Association, as well as the District 5 trustee, starting in 2017 to 2018 and being Vice President in 2018-2019. I'm really excited to be with you today and kind of walk you through my kind of where I went in dentistry and how this journey has led me to today. I knew that I wanted to be a general dentist because I like the thought of being able to do just about anything in dentistry and have a little bit more variety in my day-to-day schedule, as well as kind of getting to work with specialists and with other general dentists in the area to be able to take care of patients. I knew that the various specialties in dentistry just didn't really work for me, and I wanted a little bit of everything without having to be the end-all be-all for somebody in a specific path. So that's why general dentistry was my best path to be able to work in. Prior to starting work, something I wish I would have known. I wish I would have known that mentorship is as valuable as it is starting out. I always knew that I valued the opinions and the thoughts of the people who had come before me and of the dentists who have done dentistry for as long as they have, that I'd known in school. But kind of expanding upon the quantity and quality of mentors that I had is something that I wish I would have had a little bit more experience in time in dentistry, or in dental school, I should say, prior to entering private practice. My favorite part of work so far has probably been getting to kind of dictate my own schedule. I just started my own practice at the end of September of 2020. So I'd say my favorite and least favorite thing would be starting a practice during a pandemic. I've really enjoyed kind of getting to manage my own schedule and teach my staff and assistants and the people that I work with each day how I like to practice dentistry and how I was taught to practice dentistry. But it is also right now my least favorite part, because there's a lot of time, energy, and effort that goes into training people to be able to practice dentistry the way that I want to practice it. And so, there are some learning curves. There are some patients who leave and they're maybe not as satisfied as I want them to be, but I know that in time we're going to get firing on all cylinders and be able to do dentistry the way that I was taught how, and provide a really high level of care to people. The next question being, if you could go back to dental school, is there anything that you would do differently? No, not at all. I'd say that I was very involved in a lot of different aspects of dentistry. As a student, I try to get involved in organized dentistry, as well as in community service, as well as in the local leadership, as well as kind of doing as much as I could in a classroom setting. And I'd say that I wouldn't do a single thing differently. I know that my grades at times sometimes suffered because I spent a lot of time outside of the classroom doing other things, but I'm yet to have a patient ask me what my GPA was, or where I went to dental school, or even what my degree is. So I would say that from a student standpoint, I wanted to be the best that I could clinically, but I also didn't want to sacrifice doing the other things that matter in this life, like giving back to your community and getting to know people and making a difference in your community as well. What advice would you give to students to help in the transition from dental school to residency or the workforce? I would say find quality mentors, reach out to them, and build relationships with people. It's really easy to kind of get stuck in your own little rut and just do your thing and not reach out to your classmates or your friends or your family or people like that anymore, because it's hard to get used to having a normal routine and a normal life since you probably haven't had one in a long time, if ever. So I would say start building those good habits now, getting to reach out and know people that are close to you that aren't just dentists, that might be other people in other professions or that you live next to. In COVID-19, I know it's easier said than done to get to know people and to reach out and build relationships, but I would still say make some time in your day to just talk to your friends, reach out to the folks that used to talk to you every day, just check on how they're doing and really start to get to know them even better as people. I would say, let's see, share a story from life, school, or residency that you think would help guide dental students. Whenever I was a second year dental student, or I guess at the beginning of third year dental student, I'd planned District 5 meeting for ASDA, and I kind of let the stress of that get to me, and I was losing sleep, I wasn't working out, I was destroying all the good habits that I had created at some point because I was so worried about something that in the end never really mattered that much at all. I'd say focus on the things that matter the most. In dentistry, it's easy to get bogged down on, is my class too perfectly high? Is the marginal range exactly how it's supposed to be? And sometimes you get so focused on doing absolute perfect dentistry that you forget to know the people that are in the chair and remember that there's a patient attached to that tooth in the chair. Now, you should always focus on doing high quality dentistry, but don't forget that that's a human being that you're taking care of right there, and that's somebody's mom or dad or brother or sister or their child that's in the chair in front of you. And it's important to remember and be compassionate and try to do the things that need to be done in a way that's comfortable for them and that they can leave and have a good positive experience and a good positive outcome afterwards too. The pandemic has definitely impacted my experience since I have started to practice from scratch. I'm currently renting space from another dentist here in Shreveport, Louisiana, and I have my own practice within that practice, and he's actually been out this entire week, which was our first week. But I'd say, the pandemic has shaped this experience just to kind of say, take whatever God gives you and run with it. There are a lot of things in life that are going to be out of your control. And on our first night, we had the power go out. We lost our computer systems, our x-ray system, our internet was down, our phone lines were down on the very first day. And so you talk about making a great first impression with patients. It's hard to do that whenever you can take x-rays on them. But, life is life. It's fun. It's got ups and downs. And you've got to learn to smile and celebrate the ups and the downs equally and be just as thankful and just as happy that you're in the position that you are, because a lot of people love to be where you are. And so if you want to look at life in a negative way, you certainly can, and you can always find negative things to find in it. But if you want to look at life in a positive way, you can do that just as easily and find the good stuff that's in life as well. So I got married just over a month ago, started to practice, moved to a new state. My wife's car went out in that time. So we've got a lot of new things that are in our life right now. But at the same time, I wouldn't change any of it because it's building character and it's building resolve and it's helping us to be able to weather the hardest storms that may come later on in life. And that's exactly what I'd recommend for each and every one of you in dental school right now. So it's really easy to get bogged down and say, I'm done trying. Nobody else had to put up with this during the pandemic. But instead, I'd challenge you to look to this pandemic as something that's going to make you stronger and build those mental muscles, if you will, just to increase your strength, your resolve, and hopefully make you more fortuitous in the future.
Red line train to Braintree is now approaching.
Maybe you find yourself at a crossroads, trying to figure out what train to get on and what stops to make. I'm Patrick Mangan, formerly dental associate, now dental director in Braintree, Massachusetts, IUSD 18, formerly regent, and then CIO at SPEA. I'm here to encourage you on the path ahead by sharing some of my experiences. Heading out of dental school, I knew I wanted to be surrounded by a team of talented practitioners. When I began working with the dentists on Boston's North Shore, I really received incredible mentoring. My dream was to work on building a Mount Rushmore, so to speak, an office where a team of dentists, hygienists, and staff use their talents to improve patient outcomes efficiently, empathetically, and ethically. Now, prior to starting work, I wish I recognized how fortunate I was. Yes, I was graduating with a mountain of debt, uncertainty, living in a high-cost city. But there are a lot of other dentists out there who share your sorrows and have had to overcome incredible obstacles to get where they are today. You'll meet them and you will commiserate just like you do in clinic and lab, and you're going to make it. We have amazing potential. We can deliver excellent care to thousands of people and improve their lives. We are so fortunate to be able to do that as dentists. My favorite part of work is with dentistry, we can see the results of our work that helps our patients eat well, speak well, smile well, and be well. In just a few hours, you can see a transformation take place. In dentistry, most of our procedures have a relatively high success rate and a relatively limited set of complications, though they do exist. Now, with dental school, it was some of the best years of my life, and I would not take back the lunch and learns, intramurals, or almost anything else. Take advantages of the opportunities that you have with you right now. Enjoy meeting the people that you do. Take care of your patients. Take care of your classmates. Now, my advice to you would be to find a mentor or mentors. The first dentist I worked for is a life coach and now a great friend. He was a baseball coach, now he's a dental coach. Before I started work, I also found an additional mentor, one who works in one of the highest stress parts of Boston. I figured if I could learn from how he manages it, then I could make it anywhere. In fact, there is no one I would rather chat on the phone with at 6:30 a.m. in the morning. No one. In fact, including my spouse. She doesn't like to wake up that early, though. With this mentor, we can talk dentistry, we can talk cases, we can talk office management, you name it. And he also happens to live near the Boston Marathon course, so if and when I run by, he's out there to cheer me on. Mentors care about your well-being and your success. Find someone who sees your success as their success, is your patient's success, is your practice's success, is your family's success. That's my advice to you. Thank you so much.